So today I'm going to be doing administering an enema. So the first thing I'm going to do is gather my supplies. So I have my enema bag, gloves and goggles, my cast-off soap, and my lubricant, and my bedpan's over there. But I do not have an IV pole. And I also have my waterproof linen and towels and washcloths. So now I'll be going to put warm water in the enema, and I'll be putting 750 to 1,000 milliliters. I would have clamped the tubing first. So now I would put the soap in, but I will not be doing that today. And then I would gently agitate the soap with the water. And I would also prime the tubing. So I would take the cap off and unclamp. And then reclamp the tubing. And I would lay the enema bag on a firm surface, and then I would perform hand hygiene and put on my goggles and my clean gloves. Then I would raise the bed to a working height and lower the side rail. And I would position the patient in a left lateral Sims position. And then I would put out my lubricant and lubricate the tip of the tube 3 to 4 inches, and then I would put my hand on the patient's hip and instruct them to take deep breaths. And I would be keeping a straight face through this, but and then I would spread the buttocks and insert the tubing 3 to 4 inches. And then I would, if the patient had hemorrhoids, I would ask them to bear down while I'm inserting. And then I would raise the enema bag 12 to 18 inches above the rectum and then unclamp the tubing. And if the patient was cramping or uncomfortable, then I would lower the tubing and clamp it back and ask them to take slow, deep breaths. So when the bag is empty, I would reclamp and then remove, and I would dispose of the enema bag. And I would ask the patient to try to hold the enema for 10 to 15 minutes. And then I would place them on the bedpan so their legs would be facing this way and they would be sitting here. So I would let the patient evacuate onto the bedpan, and then I would remove my gloves and dispose of them, and then remove my goggles, and then I would document the procedure. So I would document the type and amount of the enema, the time, how the patient tolerated the procedure, the color and amount of return, and how the patient was left.